Welcome to Early Intervention Matters, the podcast that helps parents, teachers, and health professionals understand the diagnosis, treatment, care, and support of children with autism, ADHD, Tourette's, and other neurodevelopmental challenges. Your host, Dr. Inyang Takon, is a consultant neurodevelopment pediatrician, and she will provide insight through interviews, answering questions, and breaking down complicated topics. By sharing stories from parents and professionals in the field, we hope to make sense of what can be an overwhelming topic. Early intervention is crucial with children with developmental difficulties. Yes, early intervention matters. And now, here's your host, Dr. Inyang Takon.
Hello, everyone. You're welcome to this edition of Early Intervention Matters podcast, and thank you for joining in. Early Intervention podcast is a podcast series that is set to discuss matters relating to neurodiversity in children and the different challenges they have. And it's an information platform for parents where we bring experienced professionals to discuss topical issues that parents will benefit from. I'm Dr. Inyang Takon, consultant neurodevelopmental pediatrician practicing in the United Kingdom, and I will be your host for today. Thank you for joining us. So, today we're very privileged to have a very experienced clinician. We are very fortunate to have Dr. Fadaka, Dr. Kate Fadaka, who is very experienced and is dual trained. She's trained in pediatrics and child and adolescent psychiatry. It's very, very rare to get this combination. And so as we progress in the podcast, you will see why we're very fortunate to have her today. Dr. Fadaka is practicing as a consultant currently in child and adolescent psychiatry in the United Kingdom. She's been practicing in the UK for 20 years. She had her medical degree and postgraduate training in pediatrics in Nigeria before coming to the UK. And she did practice as a pediatrician for 10 years, both in Nigeria and the UK, before going on to train as a child psychiatrist. She's been working as a child psychiatrist in several hospitals in the UK. She's very experienced, an excellent clinician. So we're very pleased to have her today. Dr. Fadaka, you're welcome to the podcast, and thank you for joining us today.
Thank you for having me. It's my honor to be here.
So I met Dr. Fadaka when she was working as a pediatrician in the United Kingdom, and coincidentally, we had trained in the same hospital where I did my postgraduate training in pediatrics, although I left by the time she was finishing. But it was lovely to meet her in the same hospital where I worked in the United Kingdom. And in the course of that, we shared so much in common. And one thing that was quite clear, we were both passionate about neurodevelopmental disorders in children. And it was no surprise when she decided to go on to train in child psychiatry. We have kept up our conversations and discussions, and we're pleased that we've both seen, how things have evolved. And one thing we're both passionate about is the cultural differences and neurodiversity. And we're both passionate about improving awareness of neurodiverse conditions in other communities, particularly in Africa and other communities outside the developed nations, because of the under-recognition. And I'm pleased to say that Dr. Fadaka and I are co-authoring a book on mental health problems in children. So, and would be very relevant to people from our communities because we know of the cultural differences. So hopefully we'll be back again with Dr. Fadaka when that book is being launched so that people can get that book and read it because it will provide a lot of useful information. So thank you and welcome again, Dr. Fadaka. Thank you for all your good work that you've been doing for children.
For all your support over the years.
Thank you. You're welcome. So we're going to be talking about anxiety, and this is something that is so common now, so topical, which we feel that is still under-recognized, and sometimes parents are at a loss about how to manage this. So, Dr. Fadaka, please, could you shed more light? So people talk a lot about I'm anxious. And sometimes it can be a bit confusing as it's sometimes we feel, yes, people can be anxious, and like being anxious is an emotion. But also we know that people can actually have anxiety disorder. So could you shed more light about what it means to be anxious and what it means to have an anxiety disorder, and what's the difference?
Yeah, like you said, anxiety, like being anxious, is an emotion and it's a normal feeling of worry or nervousness that most people occasionally have in reaction to like stress. It is actually sort of a natural safety mechanism that when you encounter a stressful situation, it sort of gives you the ability to like manage it momentarily. While anxiety disorder is a diagnosable mental health disorder, when it goes beyond just being anxious momentarily or occasionally to being persistently and excessively anxious, and it begins to significantly impact the child's day-to-day life, then it's actually become an anxiety disorder and no longer just being anxious. I think the key difference is the impairment of daily functioning in the young person that differentiates just being anxious from anxiety disorder.
Thank you. So that's really important. So when people say they are anxious, it can be very short lasting and it's just situational. Whereas when you have a disorder, it's continuous, it's persistent. So it stops you from doing what you should usually do. That's quite important. So that's an important fact. And what causes anxiety in children? Can children have anxiety or anxiety disorders?
Sure, children can have anxiety disorder, and there are several factors that contribute to the development of anxiety disorder in children. Biologically, we have chemicals in our brains that we call neurotransmitters. Children that have imbalance in this chemical, serotonin, dopamine, and GABA, they are prone to getting a disorder, anxiety disorder or mood disorder. And the brain fear center as well in people that develop anxiety disorder is overactive. So the amygdala is the brain fear center. So that bit is been shown in research to be overactive in people that develop anxiety disorder. So that's the biological factors. And you have other disorders that can have anxiety disorder come up or sort of existing with them. Like you mentioned, neurodevelopmental disorders like autism, because of their core features of difficulties in communicating, needing a routine. So they are prone to anxiety disorder and chronic physical health issues as well. Those children that have chronic physical health issues are prone to anxiety disorder, and environmental factors are significant as well in contributing to anxiety disorder in children. So stressful family situations like losses, situations where you have divorce of parents, you have trauma of any kind in the life of a young person can prone that child to developing anxiety, bullying, which is very common in this day and age in our schools. So those are environmental factors. Parenting style is key as well. So overprotective parenting, shields the child from building resilience and building coping mechanism that comes from day-to-day experience. So those sort of children are more prone to anxiety disorders. Highly critical parenting as well is implicated, because in such children, they become insecure in themselves. And so do not have the ability to actually build that resilience to manage anxiety provoking situations. So these are a few kind of factors that contribute to developing anxiety disorder. And in most young people, they have more than one of these factors contributing to their developing these disorders. So that's that in a nutshell.
Thank you very much. You've given us so much information there. And I was quite interested in the bits where you talked about parenting, because most times parents will be thinking that protecting their child from, situations or making sure that they are in charge of what happens to their child might be a way from protecting them from saying things that could make them anxious. So it's quite interesting to see that overprotective parents could contribute to that. Do you want to shed a bit more light on that? Because I think that's quite, it would be one of the factors in some of our families that we say. Yeah.
So day to day, we grow in our emotions as we grow physically. And growing in emotions comes from experiences you have in life, being from just being a toddler who wants to play with another toddler and being told, I don't like you. How do you manage that? So those are the things that build resilience in a young person. But when you have an overprotective parent who does not allow the child to kind of be exposed to any form of, I won't call it adversity, but any form of conflicts to try and resolve it on their own with their own built-in sort of resilience, they don't grow in their emotions in that regard quickly. And it does affect how they manage anxiety-provoking situations. It can perpetuate, sort of maintain anxiety in such young people when they come in contact with situations that make them anxious. So that's where overprotective parenting comes in. It's good to actually allow the child to explore, why they are sort of guided from afar, just to allow them grow emotionally as they are growing physically as well.
That's really important. Thank you very much. And you also talked about overcritical parents. You want to shed more light on that? Because some of us have grown up in different backgrounds. There are times when people have felt, well, when you are very strict with the child, it makes the child better. People have grown up in such backgrounds. People have grown up with different parenting styles. So do you want to shed more light on that, the overcritical parents?
Yeah, overcritical parenting, it's not just in anxiety, it's been implicated in lots of mental health disorders. So high expressed emotions from parents. So a child that is growing up in a family where you have overcritical parents does not grow up to learn to take initiative, second guesses themselves, and does not know how to sort of manage conflict with peers. They are more likely to be bullied because they don't have that confidence built in them from home. They never know right from wrong because nothing seems to be right in the eyes of the parents that are sort of their parents. They never seem to do anything right in the sight of their parents. So from the parents' perspective, they actually mean well because probably that's how they were brought up. And, but the generation of young people we have at the moment are not programmed in a way to take criticism very well. It actually affects their ego, affects their self-esteem, and they are less likely to be able to stand up for themselves when they have conflicts with their peers. So such children tend to have perpetuated anxiety because of that. Parenting style actually, even though it's also a causative sort of contributory factor to causing anxiety, it also maintains it. So we have what we call perpetuating factors. So when you're we'll come to that, I guess, towards the end. When you're managing anxiety, these are the things you look at. Why is the child not getting better? And then you look at, the parenting side of things we haven't looked at. Because that's a big factor that perpetuates anxiety disorder in young people.
Thank you. Thank you. And what about things like parental anxiety themselves?
Yeah, so we talked about the genetic factors, isn't it? We talked about genetic factors that have anxiety disorders, mental health disorders. They are more prone to have children that have anxiety disorder. And it's actually quite difficult if the parental anxiety is not treated to actually get the child better because they sort of feed into each other. And so whatever interventions we are doing for the child, they are not as effective if the parent's anxiety is not managed as well.
That's really important. Thank you. Thank you very much. That's a lot of information there, which is so useful. Thank you. So, moving on, having told us about all these causes of anxiety, how can we recognize anxiety? How can we recognize it in children? Because we know that many children may not come out and tell us, I'm anxious. How can parents recognize anxiety in children?
So anxiety in children actually manifests quite differently from adults because in children, you can have anxiety manifest physical symptoms, emotional symptoms, or behavioral symptoms. So physical symptoms you tend to have young children in certain situations or certain times reporting stomach pain, GIT symptoms, that stomach pain, feeling like being sick, feeling tired, not wanting to eat, poor sleep, feeling, just off. But then when they go to see their physicians, they are sort of examined and investigated and nothing, So when you have physical symptoms with no organic cause, then you need to start thinking of anxiety, especially when it's situational or it's happening at certain times in the day. For children that have anxiety around school, you find out that Sunday evenings, that's when the stomach pain, feeling sick, can't sleep, can't eat. That's when all that kicks in. So physical symptoms are quite common in young people with anxiety disorder. Then you have the emotional difficulties as well, when young people keep sort of being on the edge, never being able to relax, excessive worry, seeking reassurance from parents or caregivers, often being irritable. That's a very common one, especially in teenagers, lashing out, mood swings, you know, dysregulating emotionally, all that could be anxiety. And lack of self-confidence, not being able to take decisions, that their mates, young people of the same age would be able to take those, second guessing themselves, not being confident enough to take decisions. And then behavioral symptoms, which is the main reason for referral most times, the behavioral symptoms. Avoidance behavior is a big behavioral symptom of anxiety. So a child is anxious about school, which is a common reason for referral. We refuse to go to school. A child is anxious about talking to young people of their age socially, would not go out socially, would just be sort of housebound. So behavioral symptoms are quite common. Young children, like toddlers, they become very clingy to their caregivers, tantrums, meltdowns, all that can be manifestation of anxiety. And most importantly as well, self-harm, self-injurious behavior, can be a manifestation of anxiety. So, and there are many, many more ways young people can present, but I'll just stop there for now.
Thank you. We know that, yes, lots of children who can express themselves will talk about it. What of children who cannot communicate? How do you detect anxiety in children who are non-verbal or do not have the language to communicate it?
So we explore, for young people, exploring their difficulties, as regards emotional difficulties of any kind, including anxiety disorder. We do what we call collateral information. So we get information from the parents as well, what they observe, when these behaviors that they would have reported, when do they happen? We get information from school as well, or any other person that's involved in the young person's life. And then we observe the young person in clinic. All that helps us to put information together. And we have lots of screening tools we use to gather our information as well. That helps us in sort of formulating, what the difficulties are and arriving at a diagnosis of anxiety disorder in young people. So there are lots of ways we do it. We observe, we collect collateral information, we take detailed history from the parents, and, that's how we sort of go around it for non-verbal children. Even the ones that are verbal, sometimes they can't tell you they're anxious because people with autism struggle to express emotions. They don't know how to name their emotions. So it's the same thing we do for those ones that can't identify, how they're feeling. Collateral information, family information, and feedback from school.
So it's very important that the adults around the child are very, very observant, because all these things where children do not voice out how they feel, it's the adults around them that would be observant, and including teachers at school. So that's very useful information. Thank you. I think it just highlights how much we have to be tuned into the children. So does it present the same way in different cultures? Have you noticed the difference in how children with anxiety present in different cultures?
I think presentation for anxiety is the same. but recognition is the issue. So what the parents actually report, what they think the child is presenting with, when we think it's anxiety, something else they are thinking of. So the symptoms are the same, the child will sort of present the same, but the parents do not recognize that. That's the cultural difference I've noticed in my practice. Recognizing anxiety disorder as anxiety disorder in ethnic minorities, it's different from the Caucasians. So that's the difference is in the recognition. The presentation is the same. They present as well as avoidant, although because of the parenting style of people from other ethnicity, especially like the non-developed countries, they are able to push the children through those anxieties, even when the symptoms are there, until it gets to a point where the child can no longer do it. So they tend to present later. So the ethnic minority, they present later when the symptoms are more severe. And I think it's the recognition that is the issue culturally and not just the symptoms.
That's great. That's really interesting. So hopefully families listening to this and having heard your description of the symptoms would help people recognize this better. And what do you think are the barriers to people recognizing anxiety?
I think the barriers, lack of knowledge, people just not knowing that children can have anxiety disorder. Some people don't even, some ethnicity don't believe children can have mental health disorder. So lack of knowledge is a big issue when it comes to cultural differences in managing these young people. Minimizing feelings of young children, expecting them to act in a certain way, different from what their emotions are portraying. So that's a barrier. So a child that is anxious that's come to seek for reassurance from you as a parent, and you tell them off just because you don't know that this child is anxious, you're perpetuating anxiety. So minimizing feelings of the young person is a barrier to people recognizing anxiety, because that child is going to close up until things become really bad that you don't see. The other thing as well is misinterpretation of symptoms. So we have parents that are dismissive of symptoms, and we have those that overreact to symptoms. So even when it's clear that the child has anxiety, they are chasing like a physical health diagnosis. That is very common. So sometimes it's misinterpretation of symptoms. So until the physicians have examined and said there's nothing wrong with this child, we think it's emotional, some parents don't see it. And they have the social stigma, the fear of being labeled as weak in certain cultures. You're not meant to say you're scared or you're afraid of going to school. You can't in certain culture. That's not heard of. So that fear, would make the children also really express themselves and sort of suppress their symptoms. So adults around them or parents would not pick them up. And like we've already said, the cultural expectation, it's a big part of not recognizing anxiety in children. Some people till now do not believe that children can have mental health disorder, like I said. And you're expected to express your emotions in certain cultures, if you're a male, especially, So all these are the barriers to people recognizing anxiety in children.
Yeah, thank you. Thank you, Dr. Fadaka. I completely agree. I do hear comments from some parents when you mention that the child is, having significant anxiety. I've heard the phrase like, what's there to make them anxious? They've got everything. It is there to, they just feel that there has to be something tangible that you can hold to account for it, but they don't understand that those emotions of anxiety are also present in the children. Thank you very much. So, does every child with anxiety need to see the doctor?
No. Every child with anxiety does not need to see the doctor, or when it becomes debilitating and affecting their daily function, then they need to see a professional for their input.
Okay. So, and we will talk about how parents can help, but how severe can anxiety get when it's not recognized or managed properly? How severe?
It can be quite impairing. There are young children that have dropped out of school that could have actually, they're quite intelligent, but anxiety just impeded their progress in education just because it wasn't picked up on time until they became very avoidant of attending school and, did homeschooling, it didn't work, and they dropped out. So it can be quite severe and debilitating if not managed or picked up quickly.
So just going on, Dr. Fadaka, just going back to that, how severe can anxiety get? So if I just share some of my own examples, I've had children where gradually it was getting difficult for them to go into school and then started having fainting episodes in the mornings, and gradually some of these children have found the attendance at school started decreasing and they were having panic attacks, and some of them have struggled to then go into school fully. And like you also said, I've also had examples where some of them have presented like having seizures. Investigations had been done. Had a young girl where repeatedly coming into the hospital with convulsions, and but the convulsions were not that was typical, and luckily they were seen in the hospital and had investigations and did not show any abnormality, and we've had quite a few like that. So these are just some of the ways in which some of the children and young people have seen where, like you said, the hospital would have done a lot of investigations and not shown anything. So I'm just wondering, in your practice, can you shed some light into how some of the children or young people that you've seen have presented?
Yeah.
Because I'm quite aware that some of our families, there might be people listening into this who are probably facing the same challenge as we speak, or know somebody who is facing the same challenge. So that I think it's quite useful to shed some more light on this.
Yes. Anxiety disorder is quite broad. Okay. There are lots of under anxiety disorder. You have different types. Okay. And they can present in different ways. I've had very bizarre presentations, which you will actually parents will be thinking the child is psychotic. So the child says they are hearing voices in their head, they are seeing things that other people are not seeing. They are hyper alert when they're outside on the street, looking to their right or their left, and parents are actually clearly worried that this child may be psychotic, but it's actually severe anxiety, most times from secondary to trauma. So they can present psychotic like, or I didn't want to go into all that because it's the extreme, that anxiety can present. And children with developmental tend to have their anxiety disorder presenting very differently because Dr. Tako, they have their fantasy world. So sometimes they can just go into that fantasy world as a place of comfort and talking to imaginary people. And parents will start thinking, are they going psychotic or something? Or it's just severe anxiety that is making them present that way. And like you said as well, functional neurological disorder, which we are trying to describe, like the seizures when there's no organic cause. All that is manifestation of anxiety. Children can start suddenly having nightmares, or they can start bedwetting when they had been dry previously. All that is manifestation of anxiety disorder. So it's quite a wide range. And, OCD is a form of anxiety. So their manifestation is different. So they start doing things repetitively. Excessive hard washing, repetitively arranging things because that makes them feel a bit more relaxed and manages the anxiety. So that's another form of presentation of anxiety. And if a child has been exposed to and the anxiety is from trauma, it's also different the way they present. So they may have flashbacks where they have these memories from the adverse experience popping up in their head, and that could make them go into a panic episode. And sometimes parents would notice that in those panic episodes, they report like they go unconscious, so they dissociate, and that's a way of preserving your emotions from very tough memories. So they kind of seem as if they are not with you at that time, briefly, and then they come back and forget what happened. So those are severe sort of presentations in anxiety, and we can go on and on. It actually depends on what form of anxiety disorder the person is presenting with, and then you have different symptoms. So it can be quite extreme sometimes.
Thank you. I think that's just like you mentioned, the traumatic episodes that can lead to dissociative episodes. Sometimes it's, what parents will say will be the child not being with them or switching off, and they might think that the child is having an absence or an epileptic
Mhm.
seizure. So, and one of the things you've mentioned is trauma. And I think sometimes people might not recognize the impact of trauma or what is trauma. Do you want to shed some light a bit on that? Because I think some families, because their parents are tough themselves, they may not realize that certain things that they've been able to go through can be quite traumatic events for the children.
You're very correct, Dr. Taco. We get it all the time. So trauma is actually related by whoever experiences it. So what is traumatic for each one child may not be traumatic for another. So the child is the perception of that child is what matters in that experience. And so we cannot minimize any sort of adverse experience a child has had, because to that child, it may actually be very traumatic, even though it seems very minimal in the scheme of things. So like bullying, sometimes people say, oh, was it not just they called you names? Well, that can damage a child emotionally and can actually cause significant anxiety that will impede that child maximizing their learning or even being able to go to school, you know. So trauma is subjective and not objective. It's actually the person that experiences it that can tell that this is traumatic. So that's why we do like a very extensive exploration, because sometimes parents will not readily tell you that because they didn't count it as significant. Well, that's where the professionals come in, needed to explore extensively during assessments to identify those things that may be contributing to why the child is presenting with anxiety disorder. Trauma-related symptoms sometimes is not for children, it's not as glaring as adults. So adults can tell you, oh, I'm having flashbacks, or I'm having nightmares. Children may not be able to tell you they're having flashbacks. Or that momentarily irritability can be a sign of trauma, anxiety. Because, we always tell young people that trauma is like you having a wardrobe and you have clothes all thrown into the wardrobe, not properly folded. Once in a while, they will drop. And when they drop, you have those exacerbation of anxiety because the memory has dropped. So when you have children becoming, maybe when you go to a certain place, to a particular shop in town center or somewhere around a certain place, oh, they get very irritable, they start getting angry or lashing out. You need to actually sort of pay close attention to why that is happening in that vicinity. Yeah. So trauma is subjective, it's not objective. You can't tell what traumatizes someone. The person is the one that tells you how bad they felt when they had that adverse experience.
It's very, very important, because I think you actually stressed an important factor that trauma is quite dependent on the person who has experienced it. And therefore, when this is being explored, it's important to explore it not through the parent's eyes, but actually through how the child felt at the time. Thank you. So, have you noticed an increase in children or young adults with anxiety being referred for anxiety? And what would you say is the most likely cause of this?
Yeah, there's been a surge in referrals for anxiety for young people. Increase in pressure, I think, from social media. It's a lot of cyberbullying going on that parents are not even aware of, and the young people do not share. I think social media age has actually contributed to anxiety development in young children. Uh, since after COVID, it's actually been worse. We feel that the disruption caused by COVID-19 pandemic actually increased anxiety in young people, especially the ones with neurodevelopmental disorders. They are still struggling with the anxiety from that pandemic. Academic pressure is another thing. There's a lot of pressure in schools to like do well, and it's getting to the children. That's why before major exams, we are very busy in counseling because the GCSE period is a busy period because there's a lot of pressure to, and growing emphasis on perfectionism is also a big factor. There's like standard that it's like everyone needs to fit into that standard. I think it's putting the kids under pressure. I think the news media is a big one because I find some young children that they're the ones with autism. They are very concrete in their thinking, and they can just pick anything they hear from the news media and catastrophize. Just get very anxious about it. So I think negative news in the media is a big issue. Family issues are more divorces, more, economic situation affecting families, housing, lots of families being moved from where they had emotional support, friends, to areas where they know nobody just because that's where the house is for them. So lots of factors are implicated, but there's clearly a rise in referral for anxiety in young people.
Yeah, definitely. There's been an increase and it's quite important, these factors you've mentioned. There's also been a lot of movement between countries, people migrating from one country to another. We know that different families have moved into developing nations where there have been changes, and sometimes people don't realize how that impacts on the children moving cultures. Do you have something to add to that for,
It's not even just lots of children have migrated unaccompanied from war-torn areas, and those kids have experienced horrific things that you can't imagine, and they don't speak the language, they don't speak English. So they come in, they are isolated, under the local authorities, kept in an accommodation, having no one to talk to, except they link them sometimes with their cultural community to support them. So those ones are there. And then you have the ones that migrate with families. And I don't think there's most of them do not prepare their children for the change, And some of these kids were neurodiverse and not even diagnosed before they arrive in the country. Because from those communities they are moving from, those disorders are minimized. And then they come into this country, they're going to school, and the teachers are picking these things up and referring them. So there's a lot of, yeah, you're right. With the immigration, there's a lot. They struggle to assimilate the culture, and friendships become big issues. And we know when kids struggle to make friends, it affects them emotionally and socially. So yeah, it's really rampant. The immigration is a big one. It's a big one.
it's very interesting. And I think this is something that parents need to pay attention to, and how it's one thing to move and migrate, but also thinking about the children. And it's not just, I think a lot of times people are more keen on settling them into a school and finding out about the school, but then there are other big emotional changes that are kind of not looked at to the same degree, with there being a complete change from that child moving from where they were before into a new community. So thank you for highlighting that. How can schools help children with anxiety?
Schools are actually really important in the scheme of things because if parents miss it, they will expect school to pick it. So early recognition is helpful. Making reasonable adjustment in learning method for these children, and not just being like a blanket schedule, because kids are anxious, they are slower than the other kids in the class. Sometimes we encourage school, we support young people to have flexible timetable if they're anxious going into school until they settle in. Those that are anxious, especially, schools use what we call the body system. So they, without the child knowing, just help them to make friends. And that builds their confidence, helps them to settle in and minimize the anxiety they feel socially. Offering mentoring from school is also helpful. So someone they can have a rapport with, maybe a teacher or a welfare officer, and they can drop in when they're feeling stressed to like unwind. That helps as well, and school can offer that to the children. Some schools offer school counseling, which is helpful, and just baseline building up coping skills to manage anxiety in the school environment and otherwise. And most importantly is knowing when to support parents to make a referral for professional input. I think that that's important as well for school to highlight for schools to like support parents, which most schools do in this part of the world. Most schools they would sort of sometimes pick up these symptoms even without parents noticing and support them to make referrals. I think that's important.
Okay, thank you. So, Dr. Fadaka, just going back to thank you for letting us know about what schools can do. I think that's very useful because I think it's so useful to know that schools can play a very supportive part in supporting children with anxiety and what teachers can do because many parents are not aware that there are things schools can do. Does every child with anxiety need to see the doctor? Would you say once parents pick up that their child has got anxiety that they need to seek medical help?
No, every child that has anxiety doesn't need to see the doctor right away. There are things that parents can do to like support their children. So helping the children understand their feelings is one big part that parents can do. So there are books, films that parents can get to help support their children to understand their feelings. Creating time to talk with their children is important because certain cultures don't see that as big part of supporting a child. So creating time to talk to your child is important. In that time, you listen to them, let them know that you understand and accept them. And we talked about the labeling in some cultures where they see you as being weak. When you report any mental health disorder, you say you're anxious about something. So those quiet times you have with your children are the times that you show them that they can tell you anything. And that way you can quickly recognize and know when you need to step in to support them and just sort of give build that confidence they need to like walk through anxiety provoking situations. We found that creating a routine helps every child. Although we feel that sometimes it's people that have autism that like routine. Every child does well with routines. So it helps them feel reassured, especially during stressful times. Make sure they have their routines and they're not overburdened with other things, trying to know when to do what. So you just support them to create a routine. Teaching them relaxation techniques. There are lots of apps out there. Calm is an app out there that you can use to support your child to learn how to do breathing exercises, meditation, or mindfulness. All these are ways that parents can support children that have anxiety. Some children have affiliation for arts. So you can buy books, coloring books. And when you think, oh, you see they're getting a bit stressed, you distract them. So go do some coloring, and all that. And parents can also help their children identify, what makes them anxious. So when they start feeling anxious, what's the first thing they notice? At that point, you can intervene and minimize how far the anxiety spirals. So that's the piece of what parents can do, identifying how they feel when they start feeling anxious. The first point of anxiety, how do they feel? At that point, you intervene so the anxiety does not spiral and leading them to have behavioral symptoms. Helping them build confidence, like we said, is important. Sleep is very important. Helping them have a good sleep routine. That helps a lot in anxiety. And also helping them, face the fears, take small steps towards overcoming that anxiety. So all that parents can do, and it does help. It does help. Also, I think there are lots of things that parents can do before considering sort of asking for professional input.
Thank you. Thank you so much. So, at what point would you say parents need to get to then decide, okay, I've done all these things, it's not helping? When would you say parents should see their doctor if they've got a child with anxiety?
So I think parents should set goals and say, okay, whatever they are, because there are different kinds of things that make children anxious. So if common one is anxiety towards school. So if your school attendance is not improving in a 6 months period, even though you're trying everything and school is supporting as well, then that's a point to seek professional input. And, if your child is getting more debilitated, with the physical symptoms, then you need to see a professional. So I think it's persistence for a prolonged period and no progress is the key things for parents to watch out for.
Thank you. That's really important. So I think one of the things is also making sure that they parents liaise with the schools as well. So they're working in tandem with schools to see that the support at school is not working. What would you say? So for the children with anxiety who have not been able to go to school or are stuck at home, what would you say? What advice would you have for parents where parents are finding it difficult to get them to school and the child is struggling to leave home?
Those are the kind of children that get referred to the tier 3 services. And for those ones, you need significant professional input. First line is, which has shown in research that it does help, is psychological intervention with the modality of cognitive behavioral therapy. Sometimes professionals have had to go home to like start the process, and they gradually work them to start coming into the clinic to continue the therapy sessions. And so I think for those ones, they need professional input, and therapy sessions are the first line to go. And people sort of minimize therapy sessions, but research has shown that it does work for anxiety a lot of the times without you even needing to have medications. So CBT is cognitive restructuring, because we know that in anxiety, there's the negative thinking pattern, which if it's not worked on, no matter how much you treat, they will keep having those bouts of episodes of anxiety. So that's where cognitive comes in. Behavioral therapy. So they do behavioral experiments, that's facing their fears bit by bit, following a hierarchy of fears bit by bit, taking control of situations. So CBT is the way to go, first line intervention. And if there are comorbidities, if there was trauma there, once you lay your baseline anxiety, psychological strategies, then you move, if you're ready, to deeper therapies to manage specifically whatever else may be on the line triggering the anxiety.
Okay, thank you. That's really helpful. And just a few words, because I think you touched on something. You said people sometimes underestimate the role of psychological therapy, cognitive therapy. In just a few words, just to explain to our parents what's really happening with the therapy and why is it important that parents stick to it.
So with the therapy, so people that have anxiety have what we call cognitive distortion, so distorted way of thinking. So they have negative thinking pattern, they catastrophize, they generalize. So because it happened here, it will happen everywhere. This is going to happen because this happened. So that's steady state of hyper alertness is there for people that have anxiety. That is what the cognitive behavioral therapy works on. That's one of the things it works on. It works on the thinking pattern. So young people learning self-help skills to manage their negative thinking. So self-questioning, questioning your thoughts, catching your thoughts and questioning them. Because what happens with anxiety is you have the fight-flight hormone that makes you feel those physical symptoms, so adrenaline. And what happens with adrenaline is it senses threat, even when you have a negative thought, even though in the scheme of things it's not a threat. The brain doesn't know that. And so once it senses that you're thinking this catastrophizing thoughts, you are so scared of this situation, it pumps out adrenaline because it thinks you need to escape. You're threatened. And that adrenaline brings those physical symptoms. So when you self question your thoughts, you brings down the production of the adrenaline. And so those physical symptoms you feel in anxiety reduce, and you are better able to take control of the situation. So that's what the therapy sessions we do that medication will not do. So you need to learn those coping skills. You need to learn how to talk to yourself. You need to learn how to deep breathe. You need to learn how to ground yourself. So sometimes we say, okay, think of all animals that can start with A or B. And then when you are doing that, the brain is sensing there's nothing to worry about. And then the hormone that makes you anxious is reduced. So therapy is, can't drive it enough. It's very important because in the scheme of things, even when you go on medication, you won't be on medication forever. And when you come off the medications, what are the coping skills you're going to fall back on if you didn't get them from therapy? So that's how we stress that as well, to give all you've got with the therapy sessions. That skill is a skill for life. It's not even just for the moment of the disorder. It's something we use for life.
Thank you so much. That's incredibly helpful. I think when people understand, sometimes people are just saying, "Oh, I'm going for therapy." They don't understand what that therapy is doing. And you explained it so beautifully that, families will be able to understand why it is important for children to engage with therapy. And I know we've touched a bit on this, but are there dangers of not managing anxiety?
Yeah, I think the danger is just the child not fulfilling their potentials. You know, children self-harm from anxiety. Sometimes they get so overwhelmed, they become suicidal because they can't manage. It's like your brain is just buzzing with fears all at once. So that can be too much for a child. So some of them will say they self-harm because they just need to ground themselves. So those are maladaptive ways of coping. So most times when they self-harm, it's not because they want to die, it's because they can bring themselves back to reality from this turbulence going on in their brains, you know. So it can be dangerous not to manage anxiety because when it comes to suicidal thoughts and all that, from being overwhelmed, we have misadventures. So it's not like the child wants to actually kill themselves, but just trying to do something to like ground themselves, they do something severe. So it can be quite dangerous if it's not managed.
Yeah, very important, and just brings home the what we were talking about earlier about recognizing early and parents, what parents can do. So just as we're about rounding off, where can parents get more information? I know you've mentioned some resources for parents who are listening. Where can they get more information about anxiety?
Anxiety resources, Royal College of Psychiatry website has lots of resources for children, for parents. You know, that's where we get our resources most of the time to give to parents. Then they have the Mental Health Foundation UK also has lots of resources as well for on anxiety and other mental health disorders.
Okay. And are there kind of groups for parents that they can go to? Are there any of such groups?
Yeah, there are groups, but it depends on your locality. Each locality have their groups, but I think the common ones that are readily available are neurodiversity groups. So when you have children with ASD or ADHD with comorbid anxiety, I know that they have lots of groups for parents for ADHD and ASD, all localities.
Mm.
Or you can access that through the National Autistic website to identify which one is closest to you.
Okay. So just to reiterate for our listeners, Mental Health Foundation has a lot of resources on anxiety, and Royal College of Psychiatry website has a lot of parental resources on anxiety. I think, and then also sometimes look at your local mental health service. Sometimes some of them have some information on anxiety in your local area. So we've done a lot of learning today, courtesy of Dr. Fadaka. I mean, I have learned a lot myself as a pediatrician. It's been an incredibly helpful session and very informative session. And just to recap what we've been talking about briefly, we talked about the different phase between just being anxious and anxiety disorder. Dr. Fadaka highlighted that anxiety disorder happens when there's impairment, when it affects the child's functioning, whereas just being anxious can be a temporary situation where just the child, faces that problem during that time but returns to functioning well. Children can have anxiety and they present in different ways. Some children may not be able to express that they're anxious, but there are behaviors that they can show and which can make parents pick up on the fact that the child is anxious, and this can be physical symptoms, emotional symptoms. So it's very important that parents are very familiar with their child and know when things change. It's good for us to listen to our children, be observant, and also liaise with school, because school can pick up some of the symptoms and let us know, and we observe the pattern as well. She's talked about some many causes of anxiety and environmental, genetic. One of the things you talked about as well is things sometimes we may not notice that or not realize is causing anxiety, like bullying at school. People might not notice how important that is. And also our parenting styles, Dr. Fadaka has touched on that. So one of the key lessons is, as much as we want to be very protective of our children, we need to do it in such a way that we're not being overprotective, because the children can develop anxiety, and that anxiety can be quite impairing later. And also being overcritical can also hamper our children's emotional growth as well. So we've also talked about different cultures and recognition of anxiety, and also the barriers to picking up anxiety. So there's been quite a lot, and I think all that has been very, very important. We also talked about what parents can do to support children with anxiety, what schools can do, and when parents need to seek further medical help or referral for further professional help for the children. And we've talked about also resources that are available for parents regarding supporting children with anxiety. So it's been a full house of learning today, and we just want to thank Dr. Fadaka. I just want to give some space to Dr. Fadaka to let us know about her practice and how people can consult her, because it's very hard to find a child psychiatrist. Dr. Fadaka sees children with neurodevelopmental disorders, autism, especially, those who are complex. And as you know, she's a psychiatrist. So I'll give Dr. Fadaka a few minutes to talk about her practice and how people can reach her.
Yeah, so thank you, Dr. Takon. So my practice is Divine Oasis Healthcare, and you can reach our website www.divineoasishealthcare.com and carry out assessment, like Dr. Takon said, complex neurodevelopmental disorders with comorbidities like anxiety, depression, OCD, and mood disorders. Get in touch and we see how we can support your child or your ward and sort out the difficulties that they may be experiencing. Thank you.
Thank you, Dr. Fadaka. And I highly recommend Dr. Fadaka's practice. I've referred children to that practice as well. Again, it's Divine Oasis, and that's the name of the practice, and she's given the details. So we just want to thank you all for joining in to listen today. Early Intervention Matters podcast is here to provide information to support parents with children with various developmental and behavioral and mental health disorders. We work in partnership with several specialists in supporting children. So thank you so much, Dr. Fadaka, for your time today. And for more information on our services for early intervention matters, you can also contact School Doctor, www.school-doctor.co.uk.
Thank you.
So I would like to ask our listeners, if you do have questions for Dr. Fadaka, please email eim@drtakon.com. That's eim@drtakon.com, and we'll be willing to provide responses to your question. So thank you once again for listening in, and we'll be back soon with another exciting episode. As we always say, early intervention leads to better outcome, and early intervention can only be achieved by early diagnosis. So thank you for listening into the series today. I know some of the things we've talked about today would probably have generated some questions or need to seek clarification. So I'm happy to take questions, and I'll invite you to send your questions to eim@drtakon.com. Thank you for listening in.